Welcome to Mental Health Dumpster Fire, a podcast where therapists give their real opinions on mental health, relationships, parenting, and pop culture. Hosted by Courtney Laver, licensed clinical social worker, and Jess Miller, art therapist. You can follow us on Instagram and TikTok at Mental Health Dumpster Fire. Follow Courtney on Instagram, TikTok, and Facebook at Laver Listens, and Jess on Instagram, TikTok, and Facebook at The Artsy Brain. This podcast is for educational and entertainment purposes only and cannot be substituted for therapy. We cannot provide you mental health services via this podcast or social media. We hope you enjoy the show. Don't forget to subscribe. Welcome to our show. This is Mental Health Dumpster Fire, and today we are welcoming another guest, Dr. Rachel Buehner. Woo.
Hello.
Welcome. Can you tell us a little bit about yourself and what you do?
Sure. I'm a licensed psychologist. I'm licensed in Kentucky and Ohio, and then I'm able to do telehealth across a bunch of states because I have that PsyPact passport. I've been practicing since about 2009, finished my doctorate in 2017, and I do a little bit of everything. I see a lot of adults for therapy, do a little bit of forensics, kind of court active stuff, and a little bit of testing.
Wow. Nice. That's a little bit of everything.
Yeah.
Indeed.
You're
That's
right.
how it feels. Yeah.
Okay, cool. And you were the president of the Psychological Association in Kentucky?
That's right, Kentucky Psychological Association. So I was president over there. You do a 3-year term, so right around the pandemic, 2020 to 2022.
Wow.
Yeah.
And are they the licensing board for psychologists? What does the Psychological Association do?
Sure. So that's our state professional organization. We have some connection to KBEP, which is our board, but we are sort of the professional organization. So we are a guild organization on one hand. KPA protects the practice, right? Our scope of practice, our ability to be reimbursed and get paid. And then we also do advocacy work for the field, for the profession, for the practitioners, and social justice kind of stuff for the people.
Very cool.
Yeah. And for our listeners, I think a common question that you maybe get often is what's the difference between a psychologist, a psychiatrist, and a therapist?
Sure.
How would you explain that?
We do get that question a lot. And so the difference between a psychiatrist and the other types of providers that you named is she's going to be able to prescribe. She's going to go to medical school and be board certified and able to prescribe medication. Psychologists, we go to school. You can practice psychology here in the Commonwealth with a master's degree. If you do 3 years of supervision, I believe it is, you're able to practice independently. I have a doctorate from the University of Louisville, and I practice as a licensed psychologist. And so the difference is between me and some other types of therapists is I'm trained to do a lot of testing. So IQ kind of stuff, achievement, personality, that sort of thing. So we have to do several semesters of training in that area so that we're able to do that piece of things. So otherwise, I do a lot of talk therapy that likely sounds very similar to what you guys do.
Mm-hmm. Cool.
Yeah, it's very helpful to know how to do that testing, I think.
It is.
Or to know somebody who you can send to do the testing.
Yeah.
It's interesting, too, because when I finished graduate school, I didn't love it as much. I found it to be very numbers kind of stuff and a little bit boring, frankly. Mm-hmm. And I consider myself a people person, right? I'm a talking kind of gal. But I like testing because you meet someone, you figure out sort of their referral reason, what they wish could be better. You work with them to help get an accurate snapshot of what's happening with them, whether it's cognitively or with regard to personality or background, and gathering that data about them, you're able to finish the case and really give them some guidance. And it's finish the thing kind of feeling that you don't always get from therapy, right? Mm-hmm. So what we like about therapy is helping people get better, helping them find ways to live, be more happy, more content, more at peace. Testing is kind of neat because it gives you the ability to offer them guidance, answers to questions that they've likely had for a long time, and I really like that piece.
Yeah. It's kind of a starting point almost. Like you get the satisfaction of having a conclusion and a diagnosis, but then it's also something that they can use to start with their journey.
Right, and it doesn't have to be, terrible news, even if the diagnoses, frankly, can oftentimes be new information to an individual, the reality of the situation is once we know what to call it, we know how to fix it or address it, and that can be really powerful. So I like that.
Yeah, that's awesome. What do you like best about your work?
But we talked a little bit about the testing piece, and forensics is interesting because it's endlessly new things happening, kind of new angles on how people behave. Forensics is often meeting people not at their best moment in life. Nobody, if it's court active, is having the best day of their life likely. But it is really interesting work in applying psychology principles to understand human behavior, to understand their risk of self, that sort of thing. It's really fascinating. But in terms of therapy, I love that part of therapy where you talk about in session the thing that happens, you talk about that typical sequence of, whether it's antecedent behavior or, trigger and resulting behavior, and then understand the sequence. And you're not intellectualizing it, you're just understanding kind of how it typically looks. And then they come to therapy and they say they generalized it. Like, I was out and they catch it in real time. And I'm always, I tell them, I'm really sorry for this quip, you're going to hear it a million times, but seeing it in real time, noticing what you're doing in real time and taking steps to lovingly address it with yourself, that's 25 miles of the marathon right there. So I love that part of therapy when they actually get it and they come back and they're like, I caught it, know? So
yeah, that's awesome. Yeah, I love that part.
Yeah, it really is good stuff.
Yeah. When you do forensic work, is it mostly evaluating people to see if they're fit to stand trial? What kind of forensic work have you done?
Sure. So forensics kind of runs the gamut. So I worked in the prison system, the correction system for a long time after internship and did my postdoctoral hours out there. So that's helping people who are clearly in a very difficult situation and kind of helping them where they're at to thrive to the best of your ability, right? So it's a different kind of interaction. It's a different level of frequency. A lot of things are very different about that setting, but essentially the work is the same. And then I've done a lot of the more court-active cases here in private practice, stuff like custodial evaluations and criminal competency and what are the long-lasting impacts of a traumatic event on an individual. That's kind of plaintiff's law stuff where you might work for an attorney. So it just depends. Like I say, there's a whole spectrum of the type of work that you can do.
Yeah. Have you been an expert witness?
I have, yes, several times.
That sounds scary.
It is a little bit. It's interesting. If you're doing good work and you kind of show your math in your reports, if you show how you came to your decision, talk about how you weigh different factors and things like that, oftentimes you're not brought in for testimony because your report will be strong enough that sometimes the case settles or sometimes the other party says, we're going to follow these recommendations. But when getting called on the witness stand, somebody's going to try to tear you down, so you just have to prepare yourself for that.
Yeah. Yeah. As someone who has done forensic things, do you have an opinion on Criminal Minds, the TV show?
I haven't watched it that much. I went through a period of time where I was sort of obsessed with those sorts of shows. Yeah. I haven't watched it that much, but I love it. I find it intriguing. Some of the profiling shows are why I went into psychology and specifically correctional psychology in the first place. I had a term paper assignment when I was a senior in high school, so this is 30 some odd years ago. And she said, just pick your topic out of a hat. And so the topic in this psychology class that I got was a serial killer, John Wayne Gacy. And I read a biography of him, and what was so intriguing to me about the biography was actually the sort of connecting the dots between the abuse he sustained as a child and then the acts that he committed as an adult. And I found that so compelling that I was a psych major from the get-go as a freshman in college and went straight through. So I've always kind of been drawn to this piece of how we can keep terrible things from, prevent them altogether or help a child be resilient after them. And I've kind of figured out a way to do a lot of that.
Yeah, that's great. That's a great origin story for you.
Yeah. I think it's not the happiest story, but it is, when something kind of clicks in your brain, there's no stopping it sometimes.
Right. You took something that was an interest of yours and you turned it into something that can help people. That's awesome, because there's lots of people who are obsessed, quote unquote, with true crime and learning about those things, and they just sit with anxiety.
Yes.
Yeah.
So I think that's great.
Yeah.
Thanks.
That's very cool. Yeah. I had an interest in like true crime and serial killer stuff when I was in undergrad. And then I took my first psychology class and we watched a movie. I can't think of what it is, but it was about a famous serial killer case. And then I wanted to know the why. I was like, where'd this person come from? Because the movie was just about their crimes, nothing about their background. And I just was like, I need to find the pieces of the puzzle and figure out why they did this. And that's kind of what got me into psychology was, why do we behave this way? Where does our brain develop? And it's just very interesting. Very, very interesting.
Yeah, I've got pinned on my bookmarks on my Google Chrome a link to an article that's a couple of decades old, so I can't use it in my case reviews currently. It's too old, but just talking about the correlation between different types of abuse or neglect or treatment that a child might endure when they're young, and then the correlations between certain types of personality disorders as adults. And that has been sharing that data, not necessarily the numbers necessarily, but the overarching message. When I worked with women in the prison system, that was really liberating to understand that I didn't develop antisocial tendencies or, borderline or narcissistic tendencies out of anywhere. It wasn't a manipulation. It was a survival strategy, and it can really set a person free to understand that like this wasn't a choice that I made. This was my black box closing on normal functioning, and I needed to do something to survive. So fascinating stuff.
Yeah, absolutely. Yeah. I think as people who become therapists are such an interesting breed too, because we like to work with everybody and find their strengths and find the reasons why things turn out a certain way. And I think I meet a lot of non-therapy people who are like, how do you work with those people? Like, because I used to do family and preservation work in the homes, and sometimes I would talk to people about the kind of work that I do, and they were like, how can you like have empathy for people who maybe abused their children or something? And it just shows me that I'm the type of person that can believe in people and believe that they can do the things that they want to do and achieve their goals, because they're just people.
Right. Yeah, I think there's power in acknowledging that to some extent we're products of our circumstances, but there's still work to be done. You know what I mean? So cycles can be corrected or addressed and things can get better. I was in a meeting the other day and somebody made a point that, parenting groups that we might offer, they're good and everything like that, but maybe we could do more that's like to prevent abuse and things like that. Certainly those kinds of groups, kind of choosing where we want to spend our energy. And they made the point that parenting groups that correct something after something goes wrong, if there's been a traumatic event or abuse, sometimes what you're doing, you may not be able to entirely help that parent correct course, but you're teaching the child some strategies. They're seen, they're validated, their experiences, and you might help them not repeat cycles. So it's powerful, not just for the grown-up in the room, but for the child to see that people can change, people can get better, cycles can stop.
Yeah.
You are also a board member for FEAT, the Families for Effective Autism Treatment. Can you talk a little bit about what you've done like with the board and a little bit about FEAT as well for people that don't know?
I would love to talk about FEAT.
So I love them.
Yeah, great. I love to hear that. Families for Effective Autism Treatment was started 25 years ago by a group of families here in Kentucky, and realizing that their children, each of whom was on the spectrum, there weren't enough resources here locally for them. Medical, therapy, you name it. There wasn't enough offered to support kids in their development on the spectrum. And so these families basically pooled their resources to fly clinicians in to help as many kids as they could. And by pooling their resources, it grew and grew and grew. And so now what we do is we really try to make an effort to raise money, raise funds in order to be able to offer opportunities for training, for education, for fun. It really does so many things for families on the autism journey, and I can speak to that personally about things you think you just have to forego based on the diagnosis. You start imagining a life where a child may not learn to dance or go to a prom or learn to ride a bike or learn to swim. And Ph.D. takes so many of these elements of being a happy child, getting to live a normal experience, a normal childhood, and they make opportunities available for kids. So, I've been at events where kids are learning to play soccer and they are learning to ride bikes or swim, and it's just they get to be kids. You know what I mean? They are not prevented from doing anything that other kids are able to do, and I just love that. So we have a couple of big events every year. I'll make a little push here for the 5K out at the Parklands out in May. It's a really fun event. It just changes lives. I've been on their board. A colleague of my husband mentioned Ph.D. to him a few years ago, and we ended up going to one of their fundraising events, and I just introduced myself and talked about my personal interest in helping kids, helping families on the autism journey, and now I've been on the board with them for a couple of years, and we're doing really neat stuff over there. Just I'm good with developing training opportunities for families. That's because awesome. I know a lot about that part of the journey, and it's kind of elements, once again, when you get that diagnosis, you start wondering about how the trajectory for your child and for your family and for the other kids in your family. There are a lot of things that you realize will have to be adjusted, and how much is up in the air. And parents, families, human beings aren't good with things being up in the air. I don't need to tell you two that. So, yeah, Ph.D. has really shown up for a lot of families, including mine, and I just love it.
Yeah.
Yeah.
That's great.
Very cool. Yeah, I love Ph.D. and I have a brother who's autistic, but I also have several other family members who are on the spectrum. So, we are very much into Ph.D. and the programs that they offer.
I love to hear that, Jess. Yeah.
Oh, acceptance and commitment therapy. I saw that you have some experience with that. Can you explain a little bit about what that is?
So it's just a modality of therapy that you can use. I've found it particularly helpful with working with individuals who deal with OCD. Yeah. And it has been, I would say, probably one of the bigger vehicles of change, mechanisms of change for a lot of folks in terms of understanding their thought process, slowing down on a lot of the ruminating about what's wrong with me, and being able to kind of, again, in real time, understand the sequence of what is happening and offer themselves self-soothing. And then when you kind of buffer that with a little bit of self-compassion work, it can be really powerful with people who are used to working a full-time job of self-critique. So yeah, I like that a lot.
I imagine that would help a lot with people who have some social anxieties too.
Absolutely.
Because
especially coming out of the pandemic. Yeah. You know what I mean? Yeah. People don't understand what's wrong with them and why they aren't at a level of functioning the way that they used to be. Not up or down necessarily, just different. And I think people are unable necessarily to kind of look at the pie chart of all the contributing factors to why people might not be as comfortable as they used to be. So that's a really good analogy.
Yeah. Because I see a lot of teenagers, and a lot of their presenting issues they talk about are difficulties socializing with other teenagers. And I have to remind a lot of them of you spent most of your middle school years during the pandemic at home. That's when a lot of people developmentally get some social skills, they practice those social skills. And now you're 16 and about to go to college in a couple of years. That's a lot that you have to catch up on now. So
yeah, people aren't great at sort of thinking through that kind of stuff in terms of what happened and why am I like this? You know what I mean? It's very quick to why can't I be different? But without that piece, that necessary piece of self-compassion and self-understanding and awareness,
I have these articles that came out from NPR and ProPublica in August, September, about insurance and mental health that I've been waiting for a guest to talk about because I'm not very knowledgeable.
Some interesting stuff that came out about the Kaiser 2,400 striking Kaiser mental health workers out in California starting last week. So they're off the job. And the reason that I came upon this information about this particular strike, which is interesting, you don't hear about mental health workers striking for a bunch of different reasons. But, we around here in Kentucky, we aren't able to collective bargain if you're with a public organization, but private organizations can. But anyways, they're on strike because they've had their caseloads maxed out. they're expected to do. You know what it's like working for large organizations where you have to do a lot of documentation.
Yeah.
And they're burnt out. And so they've decided to strike. And the Northern California workers for Kaiser apparently got a lot of these benefits, realized a lot of these benefits. And so the Southern California workers are now striking. And I think that it's this whole insurance piece. Well, let's talk certainly about the links. It's really interesting kind of what's happening in terms of private pay and all of that. But let's start with the articles and we can work from there.
Sure, yeah. So there are 2 articles that NPR put out. One was in August. Well, it was in August, but it was based off of a ProPublica article about therapists who left insurance networks for various reasons. And then there was an article that came out at the end of September about a man in Phoenix who just could not find psychiatric care with his insurance. There were like 2 therapists in all of Phoenix, which is a huge place. Or 2 psychiatrists, I mean. And one of them didn't take his insurance anymore, and the other one worked exclusively with Alzheimer's patients. And he was he didn't fit that. So they talked a lot about ghost networks, which to me sounds like the insurance company just didn't update their directory or have people on there who technically take their insurance but not really. Like I am on certain insurances directories, but because I work for a nonprofit, PRN, and so we see foster kids that have that insurance, but then we get phone calls all the time asking, can Courtney see me for individual therapy? She takes my insurance, and we have to say, no, she doesn't. And then they're like, yes, she does. She's right here on my directory. So it's hard for people to find a therapist that takes their insurance at all. And they're saying the insurance companies are framing it like, well, there just aren't enough therapists, but that's not true. They just don't take insurance for a variety of reasons. So, the ProPublica article that came out in August profiled a bunch of different therapists. One of them said they left the network because they interfered with her patient's care, and they, I believe they said that it wasn't medically necessary for them to be billing for therapy. Another therapist said it was just a dysfunctional process to submit claims and then appeal them and get paid because that's part of we still have to pay our bills even though we want to help people. Another one said it was financially unsustainable. This says reimbursements rates are largely stagnant and notoriously low. So, variety of reasons why people used to take insurance and then left the network and now are largely private pay. Some people were saying it sometimes takes 3, 4, 5 months to get paid for a session. And this therapist said, I see clients for 8 hours and then I spend 4 hours on the phone with insurers.
Yeah, I'm not interested in doing that.
Right. But then I feel, and maybe it's my social work education, but it feels almost unethical to not take insurance and provide care to everybody who needs it. So then it's like, do I offer different rates to everybody based on what they can afford, or do I suck it up and deal with insurance companies and take as many as I can? And how am I having work-life balance if I have to do all of my regular therapy work and then do a separate job of contacting insurance companies?
It's really powerful to, with great compassion for yourself and paying off debt like a lot of us. I'm not presuming anything about your finances, but you know, it's tough to get started. It's tough to maintain as you go along. And so to really like promise yourself that you're not going to get stuck in concrete thinking about it. So by that I mean, and I say this with all great, you know, caring in my heart, because I know what you're talking about. Like, I have the opportunity to do private pay. This was a choice that I made last year. I had dealt with a lot of the bureaucratic crap in terms of how much paperwork you're doing, how much sort of oversight and administrative just crap you have to contend with just to be able to do the work. Yeah. You know what I mean? It's sort of like paying student debt to be able to come to work. Like, in order to do this job that I love so much, I have to pay a lot of money. You know what I mean? Yeah. Well, you know, when you get there, I had this, I went back and forth about this before I went live with the practice. And one of my colleagues said to me, he's been doing this for a long time with regard to private practice, and he said, accept a few pro bono patients, or do something at a really low rate for a certain number of people or a certain demographic, or, you know, grad students or whatever it is. Like, do your part, what you can, some hours out of the week. And that was sort of helpful to me to get out of black and white and into this sort of kind of gray area of how can I still feel right about this. You know, my service orientation is telling me to help as many people as I can, but I also understand that can inflict pain on us if we can't pay our bills, or if our mind is also in, you know, our finances. It's really hard. You can't get pulled in two directions by the pain that your clients are dealing with and just the pain it takes to be at that job. That was something I had to kind of confront. And again, realizing there are some ways that I can do this, starting small in a private practice, starting manageable. You and I talked about how it doesn't have to be a full-blown, like, initial public offering like you're a public company. It can be kind of starting up slow. And then again, how much of my week am I willing to devote? How many hours, how much of my energy am I willing to devote to those who need me but can't necessarily afford my rate? Just putting it right out there. So I need to be able to continue working. And I need to have kind of my finances in check so that I can both afford and thrive being there. You know what I mean? So we aren't meant to suffer. We say it, you know, to them in so many ways. We aren't meant to suffer, you know?
Yeah. It's kind of that coming to terms with my own boundaries and being okay with having boundaries for myself, for my own well-being. Yeah. And not, I don't know if it would qualify as people pleasing, but, you know, just wanting to be everything for everybody is not a possibility.
Right. So, you know, well, I'll pass by a million social media videos about things like manifesting and things like that. And it's hard for me to imagine a scenario where I don't stress about all the stuff that needs to be done and how to grow it and all of this kind of stuff. And so to imagine a scenario where you prioritize your well-being so that you can keep doing the work almost feels like a foreign concept to us. We're just here to help. Yeah. We're just here to help. But the long game is, I joke with my colleagues and the supervisees I get to work with. I'll say, like, I want to be seasoned in a big comfortable chair, like old and wise and doing this work and happy doing this work. You know what I mean? And in order to do that, I have to manage my stress level about doing the work.
Right. Yeah. You know, I agree. And I'm hoping it's been interesting to go through a journey of different types of social work and therapy, starting off in a nonprofit and having a salary and not having to worry about the business side of anything, and then moving to private practice where it was all private pay and learning about what private practice is and how to kind of make it a business. And now I am getting a new position where it's a group practice and we do accept insurance, but I won't have to do a whole lot, I hope. They're telling me that they handle all of the, you know, if there's a problem and something comes back, that they handle it. So I'm excited to learn more about it. Because I know that people are looking for healthcare that fits in with their insurance. So I'm excited to learn more about it, but I also understand why it is such a headache for therapists, especially independent therapists, to have to deal with all of the different companies by themselves, and just trying to figure out a business plan that works for each of us.
Yeah, I had a mentor many years ago, and she said something to me that blew my mind at the time. She said, "If this is solid advice, I've come to find out, but you got to hear it all out." She said, "If you're not making six figures 5 years out of grad school, you can be doing something different, like, and not in terms of changing industries or changing fields or whatever." But I remember she sort of encouraged me to diversify a little bit. So work a little bit at this, maybe teach a class, maybe do a little bit of this. Don't turn away from leadership opportunities that can put you into networks of people who will hire you or want to work with you. And it was interesting to me to imagine a scenario where financially, like, I wasn't just a struggling grad student. It took me a long time to get out of like struggling grad student mindset. It's not a linear process either. But it's come to be good advice to me. It kept me from getting in a very like kind of fixed mindset about it and continuing to look for opportunities. And so, I said yes to a volunteer thing for KPA, and then they needed somebody to run for an election for just a board position about 8 years ago. And I said yes to that. Sure, you can put me on the ballot if you need. And then that led to another opportunity, and that's led to clients. You know what I mean? So, yeah, diversify and imagine a scenario where you're not struggling to go to the job.
Yeah. And diversifying is good for my mental health, too, to not do the same thing every single day.
Yeah.
I know. I mean, I got an MSW, so the whole time they were just like, well, you're not in it for the money. And like, why not?
Yeah.
Or like, you went to school for education. I bet they said the same thing. Like, well, you don't teach for money. Why?
I was a teacher first for a very brief time, but yeah, they were in school when I was learning to be a teacher. They were like, yeah, you're not in it for the money. You're in it for the kids. And I was like, yeah, I like that. That's like heroic and sounds great. Yeah. And then I taught for a semester and I was like, oh my gosh, this is not worth it for me. I can't do this. I'm out. I can't do that.
Yeah, and think of all the ways that a service orientation can be applied besides just like spreading yourself to everybody possible, right? Which is certainly one strategy. But there is like I say, if you take on leadership positions, eventually you can be informing policy at the state level for how we spend dollars, right? Or how we allocate funding to programs and that sort of thing. So there are lots of ways to have reach and impact that don't require you to be afraid to check your bank account.
Right. Yeah, we can feel successful in multiple ways.
Right.
Yeah.
And I think, hate to get on my feminist soapbox again, but we're in a woman-dominated field, and it's just kind of an assumption that we're just going to help because we want to, which is true, but also I would like to be sane and feel like I can have my own life outside of my work. So it's important to remember, like, no, we also would like money.
Yeah. Right.
Yeah.
The work is too difficult and it requires too much of us to feel like everything outside of work is also, stressful, just trying to be able to get there to do the work. So like I say, that ability to see the long game and think, how can I manage the expenditure of my time and my energy so that I'm doing what I like, doing a few different things that I find interesting. Now, that's me. I like doing a few different things or having a couple of different things going on, and not just struggle to do the work. So like you say, that's boundaries, that's work-life boundaries, but it's also prioritizing your well-being long-term.
Yeah. I had to learn that too with just the clients that I accept. I have to learn, especially coming from nonprofit where it was kind of like you get the clients that you're assigned.
Yeah.
Now I'm in a place where I can say, like, this client I'm not going to be able to help this client effectively with my own things. So being able to help them find somebody who is a better fit and not feeling guilty about, like, we are not a fit and that's okay.
Yeah. Once I started, like, because at first when I first started working in the private practice, I was just kind of like, yeah, give me anybody. I just want to build my caseload. But as soon as I started not being pickier, but as soon as I started like looking for or advertising myself for my niche area for clients, my caseload just like went way up. and I wasn't getting anyone who I felt like I wouldn't be able to properly treat because I just didn't have the experience. And then like now everyone on my caseload is in my niche area.
That's great. Didn't that make the day better?
Oh yeah. And I feel so much better going to see my clients now. Like I'm like, I know what I'm doing.
Yes.
I have a plan for most of them, and some of them I'm like, I have an idea, but I'm also going to let you kind of drive the bus today of what you want for your session to look like. And it's just made the job way easier for me versus where I'm going in, I'm like, oh my gosh, I don't know what I'm doing, and kind of imposter syndrome because it's of a client of an area I've never worked in. It's just not part of my expertise. So rather than trying to make myself a therapist for all the people, I'm a therapist for a niche group that really needs therapy and really needs a therapist. And it's so much better that way.
Great for everybody. Win-win.
Yeah, exactly.
You're better for it, and you're better for them. So
yes, exactly. Yeah.
What advice or what could we say to people who are looking for a therapist or a psychiatrist or a psychologist, whatever, and aren't able to find someone in their area who accepts their insurance? Because I think we did a good job of explaining where we're coming from on this side of it, of why we maybe don't accept insurance or can't accept insurance. But what can we say to people who are looking for care and can't find someone with their insurance?
Sure. So you want to see if that money piece is pretty prominent in your search. I think making sure the person can either do a super bill or they're going to regularly give you documentation to submit for repayment. They're not going to get your full rate likely back from their third party payer, but they will get a big portion of it. They'll get a similar rate to what somebody in network would get. So just making sure that they kind of know the questions to ask. Do you do super bills? How quickly do you have availability? Are you able to do weekly? So we want to make sure kind of the energy is right, the vibe is right. Does it feel like somebody who would be a good fit? And then again, asking those questions so that being there is not just getting to the session is not as stressful. I think it's pretty powerful stuff. Like I say, for us, for my practice, we do that monthly billing that allows that person to submit for reimbursement. And it's not terrible. It's 4 to 6 weeks, I think, to get it back from the insurance company once I give it to them and they submit. So it can be done.
Yes. Yeah, definitely be honest about what you need and ask for help from the people that you're going to seek help from.
Right.
Yeah. Because I think, I don't imagine that there's any therapist who doesn't take insurance that doesn't care about people who want to use their insurance.
Right. No. And so everything can be done. And like I say, super bills, reimbursement paperwork, all of that to facilitate that for people, especially getting started, gives you access to more folks and more folks access to you. So that's a good thing. There are ways to facilitate this process for everybody.
Yeah. Yeah. I understand the frustration though, because health insurance is expensive on its own. And then to say, all right, I'm budgeting for my health insurance, and then I'm budgeting on top of that for full fee therapy, that can be a lot to digest.
I've got a couple of clients, I know that it's a lot for them to afford my rates. And I think of two of them in particular have said to me, like, the notes that I write them after therapy, to kind of summarize what we talked about, like they take that and they work with it. Like if I'm going to pay for it, I'm going to utilize it. And I'm not saying it makes a person necessarily more motivated, but sometimes it does. Like if you realize, like if I'm going to go, twice a month, I'm going to make sure I really bring it when I'm there and talk about what needs to be talked about. They'll often show up with lists of things they wanted to make sure and talk about. You know what I mean? So we're not doing that like back and forth of, so, you know what I mean?
Right. I love when a client brings in like a journal. A lot of the teenagers that I work with have like the journaling app on their phone and they bring stuff in. I'm like, yes, thank you. This is going to help so much.
Well, I think it's a real parallel process too, to say like, if you come in and you tell me what's important to you, like what's really like been either the rough point from the last couple of weeks or something that's just, you feel like it was a particularly difficult thing. When they bring that to me and they tell me what their needs are, I think that's a really good exercise for life to be able to say, that I recognize the thing, I recognize how important it is, I'm enlisting support. That's powerful. You know what I mean?
Yes. Yeah.
this is cynicism talking, but I do think that the process from the standpoint of, third-party payers and things like that, like, I wish that it weren't so murky for clients, for people. There is no sort of kind of grand concierge service where, we map Psychology Today to the Louisville Therapy Networking Group to, where they know who's available, who's taking insurance, what's the wait like to get in, like that. It's still very word of mouth. It won't be that way in the future. But I wish right now the process weren't so murky.
Yeah, because even Psychology Today, not everyone's on there. It costs $30 a month to be listed on Psychology
their
Today.
Stuff, availability.
Yeah.
You're really at the mercy of the internet. So I wish it weren't so word of mouth and so murky for the average consumer. I hope that's something that we can rectify.
Yeah, the therapy networking group has been
great.
I have utilized that so much. Like, it seems like every time anybody just mentions therapy, I'm like, I can help you. I can get on there. Like, what do you need?
Yeah. I've been using it to refer people a lot lately.
It's been huge. Yeah. Okay. I found a Reddit post about parenting that I thought would be interesting for you as an art therapist.
Cool.
And it was posted only 9 hours ago, and it already has 200 comments.
Whoa, that's a lot for Reddit.
Yes. And this person got a little defensive, but maybe rightfully. I'm not sure. The title is 3-year-old drew a family picture without me.
Okay, yeah.
I am absolutely heartbroken. My 3-year-old drew stick images of her sibling, dad, herself, and her baby doll. When I asked her where I was, she didn't respond at first, and then drew me in a tiny available space and said, "That's you yelling at me." I do yell at my kids, not more than the average mom out there, and I did not yell at her today. I feel horrible and isolated. Maybe I'm just tired and hormonal. This did hit hard. That was the original. She put some edits in there, but that's the original post.
Got it.
So what are our thoughts?
All right, Jess, I'm going to let you weigh in first.
Yeah. So, developmentally for a 3-year-old, you got to take whatever they draw with a grain of salt because they're 3 years old. They can barely hold a crayon. And they, for the most part, when 3-year-olds are drawing, it's the movement, right, that is satisfying to them, not the end product.
Right.
So they might have started to draw their family, and then it turned into, oh, this squiggle looks like a cat. It's a cat now. So you got to take it with a grain of salt with a 3-year-old drawing something. In the art therapy world, we do have an assessment, the kinetic family drawing, where we ask the client to draw their family and everyone in the family doing something. And it's a very open interpretation. But that is a directive assessment. And then we look at who's left out of the picture, where they are and what they're doing as part of the assessment. For a 3-year-old to just spontaneously draw a picture and say, these are these people, that's not an assessment, that's just the kid drawing. But I understand why that mom or parent was kind of upset that they were left out and that they were put in the picture doing something that they're not super proud of, for yelling at their kid. So I get that. I get that being frustrating, for sure.
Yeah.
Yeah, the first thing that went through my head, I think that was a really good answer, by the way, but let's assume good intentions. Let's assume about all of our family members, but especially the 3-year-olds, good intentions, that they didn't do anything to, it wasn't a purposeful or intentional slight, and assuming good intentions. Again, we can turn this into a mountain, or we can choose not to. We can look at it as a drawing. We can ask them, where am I? And hear what they have to say about it and not churn into, full panic about what that is. We can take that into consideration, that they think I yell a lot. And like most parents, you're going to have moments where you think about yelling and you think I've done terrible damage and, oh, I'm so bad. And you're going to start to make it a character thing with yourself. And the reality is getting stuck in self-critique is almost an avoidance strategy. for positive change. So if you catch yourself going, oh, they think I yell, I'm terrible, blah, 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 take a deep breath, right? And acknowledge the power that you have in the moment versus staying stuck in what's happened previously. So the kid drew a picture. You can make it into a huge thing, or you can try to make the rest of today great.
Right.
You know what I mean? So let's start from right where we are right now. And again, I think it's cathartic to tell the internet or tell people who care about you, this is what happened. What do you think? But the reality is we can make it a really big thing and, drive the family into drama and, turmoil, or we can say, must have been a rough morning. I'm going to try to make it a good rest of the day. Let's start from where we're at. And that's another way you could go.
Right. Yeah. I think it's pretty rare to find a vindictive 3-year-old.
Haven't met one yet.
Yeah.
And I'm an old lady. I haven't met one yet.
Right. So to be taking it this personally, I think maybe some personal reflection on your views of your parenting might be helpful. Because I doubt that they were thinking about it that deeply of like, I'm not gonna draw you. And if it was like you said, like maybe a bad morning and they were just in a mood and they're gonna forget about it in 20 minutes.
And even if they were trying to send a message with it or show it to you with you notably absent, that in and of itself is a message. That could be a bid for attention. Like you can look at that in all sorts of ways besides a manipulation. And again, start from right where you're at. Can we turn this day around and make it a good one? Can I go out of my way to make sure I hang on to any yelling and do my best to communicate lovingly for the rest of the day? We can either stay stuck in what happened or we can start from here.
Yeah. Yeah, exactly. You can take that and you can use that information to connect with your child and spend more one-on-one time with them, doing something attachment building and giving her all of your attention for 10 minutes and just doing something fun and not worrying about doing things correctly or making it a teaching moment or something. Yeah. I also feel like if you're going to talk about something a child made, asking questions can often come across as a direction. So asking, where am I, could have been interpreted as like, oh, I need to do that now.
Certainly, it's very binary. I'm not in this. You know what I mean? And that's what the person sees as the target.
Right.
In forensic interviewing, we talk about the importance of open questions that aren't suggestive from the get-go. So you would start that query with, tell me more. Tell me more about this.
Yeah. Tell me about your picture.
What I mean? Ooh, this is interesting. Tell me about this, and express that wonderment, because otherwise they see with those W questions right off the bat, where am I? What does this mean? You know what I mean? That something is wrong with what they drew.
Exactly.
You know what I mean? So if you want to know more, that expressing wonderment, pulling yourself back from the questions and maybe trying harder at the wonderment piece and tell me more can be really useful with kids, little ones.
Yeah, or just making observations like, oh, you drew your baby doll. Your baby doll's in your family. Yeah.
Say what you see. Say what you see. So.
Yeah, I was taught in grad school in art therapy that you do not ask W questions about their artwork. You let them tell you about it, and then you ask open-ended or clarifying questions about the art. But you do not ask them why or what or who or where.
I'd love to know more. Tell me more about that.
And if you ask a kid that, they will talk all day.
That's
right. They want to talk all day about what they drew, if you phrase it that way. But as soon as you put in a W question, you're putting in like a feeling of judgment on their drawing, and they pick that up right away.
Yeah.
They're smart.
So it's interesting. I think the original post was about her child not drawing her in the family picture. The comments really honed in on the yelling part and were critical, I guess, and also sharing their own struggles with not yelling at their kids. So they really focused on the yelling part.
Interesting.
So she added an edit to this post. She said, "Thank you, everyone who took the time to read and respond, supportive or not. It is striking to me that there's shaming based on the fact that parenting is all about putting the feelings or needs of the kids first, which I normally do 90% of the time. However, hear me out as a fellow parent and a person. Isn't parenting also about ensuring that the parent is able to support themselves and being a stable emotional I'm correcting their grammar as I go.
Yeah.
And being in a stable emotional state to be able to help their kids succeed, mostly emotionally. I will clarify that I am not expecting my toddler to manage my emotions or even try to make me happy. Her pure existence brings me happiness, and I did not shame her into putting me into the picture. I just said, hey, where am I in your picture? How she responded to that question is why I'm here. I ask those who conclude that I must be an abnormal parent yelling all the time, why can this not be about me? Why is it shameful or irresponsible to be able to express an emotion I felt strongly as a parent? When you constantly put your kids first, what are you teaching them? That others' feelings don't matter? That every situation that makes the parent upset can be viewed from the lens of how do I see from the child's point of view my emotions can come later? Can I not be sad even for a moment that I am not in their world? She's still very emotional about this.
Oh, yeah.
About this picture.
She is very, and with people commenting so much on the yelling portion of that short post that she originally made, I don't blame her for feeling a little emotional about it and a little defensive maybe about it too.
Yeah. But I think it maybe brings up a good point about either chronological age-wise or gentle parenting, whatever your parenting method is. When is it appropriate to share your own feelings with your children, and when is it detrimental or harmful, or maybe those are extreme words to use, but it seems like people were saying, it's not about you and how you feel about it. It's about how your kid feels, and clearly she hates you because you yell at her.
Well, I think with regard to a parent's feelings, giving a child a sense that something that they did made you so happy, or that you're so proud of them that they give you positive feelings, that's super powerful. Every child needs that. You need to know that, that's how we come to sort of understand ourselves, is the way that other people react to us. That's learning, you know what I mean? But I think being really careful not to do the same thing with some of our maybe less positive emotions. You don't cause me anger. Something that happened might cause me anger. You know what I mean? You don't cause me shame. You know what I mean? You don't, all of those things, my sadness, I deal with my stuff. It's not because of you. That we're careful not to create causation or to kind of communicate causation. And I think too, I think it's really powerful when we think about how we want to model for children our emotions. I talk about this a lot with regard to parents, especially moms who are depressed. And then oftentimes the conversation about how do I model anger for my children. I think the ability to say a couple of things. To say, I was feeling blank, and so here is what I did. I was feeling really low earlier. I was really sad about something that happened at work. And then I called your grandmother, and I went for a walk, and I felt a whole lot better. You know what I mean? So modeling for children, I have feelings, and here's what I do. I have feelings, here's how I enlist support. I knew I was sad, I knew I was upset, here's what I did. I think that's really powerful. The ability to manage our feelings in front of our children and realize that when we have mishaps, when we have yelling episodes, and we will, that we are accountable for those things. And so we say, I shouldn't have raised my voice. That was more than you needed from me. You know what I mean? I should have handled that differently. And for that, I'm very sorry. Or I made you sad. I can see that. And I didn't mean to do that. Let me try and make it up to you. Can we start over? So acknowledging what happened, acknowledging the impact that it had on somebody, and telling them how you're going to correct it is perfect apology and accountability. And if we can do that with our kids, imagine how powerful it would be if when somebody transgressed your boundaries or hurt you in some way, if you reliably knew about the world, that somebody would say, oops, I didn't mean to cut you off, my bad. Oops, I didn't mean to say it that way. I didn't mean for it to impact you that way, and I'm really sorry. Let me try that again. The world would feel very differently to us. You know what I mean? So again, I think the level of making sure that they don't feel responsible for your feelings, and making sure that when there is some sort of emoting of feelings at a level that you're not comfortable with, that you make it right. I think that those are two kind of powerful ways to do things. And, some might call it gentle parenting, whatever you want. I'm perfectly comfortable and proud of that label. But the idea of treating your child with respect, I'm not there to make you afraid of me. I'm not there to make you feel small compared to me. I'm not trying to break you down first. I love you, and my job is to not make who you are. It is to figure out who you are.
Mm-hmm. Yeah. That's a great way to put that, to figure out who you are. Yeah. No, I think that's exactly right. I think she, I'm assuming she's the mother.
She doesn't
she doesn't identify herself, but I guess I'm assuming. She's trying to make it a teaching moment for her child to recognize, like, you not including me hurt my feelings, and can I share that with my child, or is that inappropriate? And in some ways I'm thinking, I don't know that a 3-year-old would pick up on that and be able to, like, put together how that works. And also, I think you're reading too much into it. But I also think it could be a learning moment for the mother to think of how she's feeling. Like, she could take the comment about, that's you yelling at me, as a moment to be like, how can I respond differently in the future?
Yeah. And so we might tend to rationalize in moments like that. But I wasn't trying to, or I didn't mean to, or I'm just over here trying to, and I'm not speaking about her specifically, but any of us will become defensive. That's how we protect ourselves from feeling yucky.
Yeah.
But the idea of going, wait a second, I don't want this to, like, recapitulate a pattern of yucky. Like, let me stop, take a deep breath, walk away for a second, and realize, like, let's make today good instead of looking for, I don't know, the internet can be ruthless sometimes in terms of their response. So to each their own, though.
Yeah. That's, acceptance and commitment.
Indeed,
there it is.
indeed.
Did not feel great, and then you're committing to helping it be better in the future.
That's right. That's right.
Yeah. So great. I feel like we just all need to accept things and.
Yep.
Yeah. Yeah. It's a lot of the comments are
not nice.
Well, I grew up in a home where my parents yelled at me, and here's what I'm doing to not yell. Whereas, I think she was looking for some empathy and some, it hurts your feelings when your kid doesn't draw you, but it's gonna be okay.
Right.
And, yeah, the internet is an interesting place to go. Sometimes it's kind of a 50-50 shot of whether you're gonna get that validation or get shot down.
Right.
Yeah,
It's
and
tricky.
I think your parenting skills, the ability to be a good, loving parent, there aren't really much more vulnerable spots on me than how good of a job I'm doing at that. So opening yourself up to critique that way. I love a person enlisting support, but just understanding that it may really hurt, So, but again, to each their own.
Yeah. Do you feel like, as someone who posts content on the internet, do you get a lot of critique or negative feedback?
Not really. No, it's been a pretty positive experience so far. I'm not saying anything too controversial. Sometimes I think I've gotten a few DMs or things like that from folks who some of my stuff on overcoming trauma and working through trauma, just people have more questions about that, but it's not necessarily negative feedback. Trauma recovery, trauma processing is such a subjective experience, you know what I mean? So, but no, for the most part, it's been pretty positive.
Good. Asking for advice is a good way to become pretty polarizing on the internet, I think. Yeah.
Yeah. So I talk a lot about trauma and a lot about anxiety and a lot about just kind of self-compassion, and those are not super controversial topics. What I try to do is just point to stuff that's kind of experienced by a lot of us and give people some things to think about, like in a very kind of quick way, or later on today when you think about some cues for thinking about things. So if you look at any of my content, it's we're not breaking molds or anything like that, but just kind of helping people understand research and understanding a few things that you could think about that might make today a little bit better. So we're just going to baby step,
Is there anything else that you would like our public to know?
or if you have questions for us.
No, I do like talking about the social media piece of it. I think social media in terms of mental health, you guys do such a good job about discussing that. And I think that it's really easy for folks to kind of malign the discussion of mental health online. You know, we hear, you know, about kids coming in saying I have X, Y, or Z diagnosis because they saw it on TikTok. But I think, you know, we're having two conversations about seemingly different things that are actually very interrelated. We're saying people don't have access to the mental health care that they need, but they're also figuring themselves out on social media. And I think there's real power in giving them accurate, palatable, usable information, and for people to share their life experiences, their lived experiences. You know, anything taken to the extreme is kind of dangerous, but I love seeing people able to talk about their mental health, able to realize, you know, we talked about social anxiety a little while ago, realizing that you're not all that different from a lot of people. And it's not about I'm happy that others are unhappy. It's about realizing a lot of people are going through this. So if you get out there, a lot of people might be just as nervous as you. That's so liberating. That's such a good feeling to have about, you know, the commonalities about things. So I think, you know, harnessed appropriately and with accurate information out there and teaching people to think critically about what they view, I think that the internet is going to be so powerful in helping people with their mental health.
Yeah, I agree.
Yeah. There's a lot of like TikTok accounts that I follow that are lived experience type TikTok accounts of autistic and ADHD individuals for the most part. And like, I watch them and I'm like, ooh, like I'm seeing myself in a lot of what's going on here. And then that kind of got me into the, like, let me do more research and asking professionals their opinions and then discovering my own neurodivergencies and being like, oh, okay. So now I have this framework of how I can look at things that makes sense now of like, okay, that's why that happens. That's why my brain does this. And then this is what helps with this. And it just like that for me was amazing. And so I appreciate that I was able to do that through TikTok and through social media accounts. And I want that to be the experience for everybody. And I think you're right. Like that critical thinking component is really important of like, who are the proper sources and where can I get the information? And I think some people, like teenagers, skip that part. And then they come see me and they're like, I have bipolar. And I'm like, let's talk about that real quick. Yeah. This is our second session, but let's talk about it. I'm not here to shut you down, but I'm here to talk you through it and help you find the information. And then it's usually ADHD and not bipolar.
Yeah, as it turns out. So, yeah, when you know, receiving a big diagnosis, I had somebody say to me a few years ago, I was just stunned by the diagnosis one of my family members got, and I kind of was reeling for a little while about how it was all going to look, the path, and we talked a little bit about it today. And somebody said to me, your family is going to look to you for how to absorb that information. You are the lead of your family, so act accordingly. Yeah. And that was the swift kick in the pants that I needed. And I started I dug into the research, certainly, but I also dug into social media. Like, how are families dealing with this? You know what I mean? And an advocate was born. I'll tell you what, I saw how other people were living and thriving and advocating and protecting and not just mama bear stuff, but on behalf of all people contending with that diagnosis and families trying to thrive. You know what I mean? So I think that there is a lot out there that we should be thankful for in terms of content that can help us live better lives and understand ourselves better.
Yeah.
Yeah. Hopefully the three of us can be a small part of that.
Yeah. I think we really are.
Yeah.
I think we're doing a good job.
Yeah. All right. Well, thank you so much.
Oh, thanks for having me.
Joining
this was great.
us. This was awesome. Please subscribe to our show. Please share it with as many people as possible. We need a comment.
I think actually, and I'm working in November, I want to make sure and talk to folks about gratitude and not in like it works for everybody sort of way, but I think that sometimes it can be a good salve in an anxious moment, like what's okay right now, right? Like what's okay right now is a really powerful kind of stop and breathe moment for anxious panic. Doesn't solve everything, but I'm not here to tell you what to do, but what is okay right now? Like stop, take a deep breath, identify a couple of things that right now are okay.
Yeah. No, I think that's
like
great. I think that's a great idea. Comment what's okay right now in your life, and then I feel like a college professor on an online course. Comment on somebody else's and congratulate them on what's going okay in their life.
Yeah. Share the wealth and the gratitude with each other.
Interact with each other. Come on, talk amongst yourselves.
That's what we want. We want a community. So
we're trying to build more community.
Build
with
each
this.
other up in the comments, please.
That's great.
All right. And then again, of course, join us again next week. And have a lovely week. Bye. Goodbye.